I'm Dr. Ken Landau. Do you suffer from nasal allergies? Well, if you do, you're one of about 50 million people here in the United States who have similar problems. The nasal allergies can cause sleep problems, they lead to daytime fatigue, they cause problems at work, problems at school. We spend about $17 billion treating nasal allergies in the United States every year. And unfortunately, while 70% of the people with the allergies are going to use some kind of over-the-counter medicine, at least half of the people are dissatisfied with their chosen therapy. Well, in 1994, the Food and Drug Administration authorized sale of Flonase. Flonase is an intranasal corticosteroid. Intranasal, you place it inside your nose, you spray it inside your nose, and it contains cortisone. In 2014, the Food and Drug Administration said to the company, you can go sell it over the counter. It actually was the second steroid available over the counter. Now, it's important to realize that Flonase, or the generic equivalent of the Flonase, called fluticasone, can be used in people over age 4 for nasal allergies, not for symptoms of the common cold, but for nasal allergies. And they work extraordinarily well. When they were prescription, it seems the Food and Drug Administration only authorized their use for nasal allergies, but they actually work very well for ocular allergies, eye allergies as well. Eye symptoms can be treated by the intranasal corticosteroid, not sprayed into the eye, but sprayed into the nose. Well, the problem is typically an allergic reaction to something. Hay fever. So you're allergic to pollen, you're allergic to dander, you're allergic to mites, you're allergic to mold. And unfortunately, it causes lots of symptoms. Symptoms in the eyes, itchy, watery eyes, symptoms in the nose, itching or sneezing or congestion or running. And what's the therapy? The therapy for the overwhelming majority of people is best used with an intranasal corticosteroid. Now, medicine like Flonase, onset within 12 hours of the first squirt, but it doesn't really reach its maximum level of benefit for about the first 7 to 14 days, and you can use it for months and months without seeing a doctor. Now remember, it's to be sprayed only into the nose, not into the eyes, not into the mouth, and because you're applying the top into the nose, for hygienic reasons, just one person per bottle. The medicines are extremely effective, and at least as effective as every other kind of medicine out there on the market. Typically comes in 2 sizes, a smaller size, 60 sprays, a larger size, 120 sprays. They call one, the smaller one, the pediatric dose, pediatric size, and the other the adult. But they contain exactly the same medicine, exactly the same concentration, just different number of sprays. How do you use it? Well, 1 spray per side, morning, 1 spray per side, night, or 2 sprays in the morning on each side, for about the first week, and then you cut down to 1 spray per side per day. If you're an adult, if you're a child, you start off with, and you continue to use just 1 spray per side per day. How do the medicines work? Well, they cause the vessels to constrict, and they stop the release of some of the allergy-relating substances, what we call the cytokines and the inflammatory cells. It prevents them from being released inside the nose. And the inhaled corticosteroids, for those people who have mild to moderate symptoms, guidelines say that is the therapy. You don't have to add anything to it. You don't have to take anything in addition. Unless you have moderate to severe symptoms, then you might need an add-on medicine. You might need something in addition. Well, are there any side effects? Sure, but the side effects are not really significant. It's some nasal dryness or irritation, maybe some burning or some bleeding. Maybe you get a sore throat or a peculiar taste in the back of your throat. And in some people, it's possible maybe to get overgrowth of yeast, but that's extremely rare. Now, people worry about cortisone and corticosteroids and side effects from cortisone, but the intranasal cortisone doesn't really get absorbed into the body. So it's only when you take the pills or when you get a shot and you do it at a high enough dose for a long enough period of time, then yes, corticosteroids, cortisone, prednisone, can lead to cataracts and glaucoma, can lead to fluid retention and high blood pressure, can lead to muscle weakness and osteoporosis and loss of calcium from the bone and peptic ulcers and mood swings. But the good news is when you use the intranasal corticosteroids, only 2% of the material is bioavailable and it doesn't really get anywhere outside the nose. Where can you purchase Flonase or similar products? You can do that at any grocery store in the drug department. You can find them in every single pharmacy. You can find them at Costco and Walmart and Sam's Club. And they're all relatively inexpensive. The smaller bottle costs about $15. The larger bottle costs about $25. Lasts about a month. Other names, Rhinocort, Nasonex, Nasacort, Veramist, Becanase, all of these medicines also contain intranasal corticosteroids. What are the other options? Well, they're the antihistamines. You can use an antihistamine either as a spray. They're still prescription, still fairly expensive. They only last about 4 hours, have more side effects, seem to be less effective than the intranasal steroids. We know you could take an oral antihistamine. That's the Benadryl, chlorpheniramine. Well, these medicines cross the blood-brain barrier and they get into your brain and they make you sleepy. They make you have difficult time staying awake, concentrating, going to school, going to work, driving a motor vehicle. Well, they have a new kind of antihistamine. We call it the second-generation antihistamine. That's the Allegra and the Claritin. Those medicines seem to have fewer side effects, but for many people, they don't really relieve all of the symptoms. Then you can use a decongestant. A decongestant is a spray. That would be Afrin. You only use it for 3 or 4 or 5 days, so if you happen to have allergies all year, that wouldn't be a choice. Or you could take the decongestant by mouth. That would be the pseudoephedrine. That's when you see Allegra D or Claritin D. The D is a decongestant, but unfortunately the decongestant can stimulate your heart, increase your blood pressure, cause urinary retention, cause tremors, cause sleeplessness. And as a result, they're not very well thought of. Well, we have other medicines too. We have something called an anticholinergic that can help dry the secretions. That's a spray. It's called Atrovent. We have another medicine called Nasachrome. Nasachrome is a medicine known as cromolyn that helps also stop the mast cells from releasing some of their chemicals inside the nose and cuts down on the allergies, but doesn't work nearly as well as the steroid. And then we have another class of medicines typified by Singulair. Now it's important that you realize that you can use the intranasal corticosteroid by itself for the overwhelming majority of people who suffer from nasal allergies. But sometimes, if you have severe symptoms, you might need an add-on drug. Maybe you take the oral antihistamine, maybe you take the antihistamine spray. And if you do that, we ought to be able to make you function much better, fewer side effects, feel better, and then you'll be happy with your therapy. Anyway, thanks for watching. I'm Dr. Ken Landau.